Yes, yes. Hello, everyone, and a Merry Christmas to you and you and you and you and you. It's Dr. Tamara Beckford from Your Caring Docs. We're telemedicine urgent care. We help small business owners, entrepreneurs get seen overnight quickly for their non-emergent medical issues that occur at inconvenient time overnight. We're the overnight doc, so you can successfully open up your business by morning, right? But every Friday, we give medical content, right? So we teach you what's going on in your body so that you can make great medical decisions. So this is our last episode for 2020, and what a year it has been, right? We started everything in 2020, pandemics going on in 2020, COVID vaccine is now out there, and some people have gotten the vaccine. So I'll give you an update. In 2020, today is Christmas, and we are hoping that next Christmas we can all celebrate with our families, right? So 2020 has been a year. I know it's been rough on all of us. We've gone through so many changes. I mean, it's like all of a sudden you can't hang out with your family, you can't hang out with your friends. If you do hang out, you have to wear a mask, hand sanitizers. I mean, you would have normally washed your hands, but now it's just like, hey, how you doing? Yeah, it's great. And hand sanitizers like constantly. Grandparents have not been able to visit their grandkids. Like, I haven't seen my parents since February, right before the pandemic. Yeah, it's been a long time. Usually we'll see each other every couple months, but I haven't seen them, and I probably won't get to see them again until February. So it's gonna be one whole year. So they haven't seen their grandkids. Some of you out there have gotten sick. You've had COVID. Some have recovered. Some of us have lost friends or family to this crazy pandemic. It's really been a year. In addition to that, with us starting Your Caring Docs, I've decided that I wanted to go out and educate our population, and that's why I do the Friday sessions like this with some medical topics. Now, we've been doing quite a bit, and I've started to document, and so I was going over all that we've done so far. You guys are super educated. Now, why do I do this? Is it to just, go out there and brag? No. I do this so that you can understand what's going on in your body. So when you're talking to your doctor, you can understand and work with your doctor on a plan that will work for you because you know what's going on. So the info that's presented to you is not over your head. When the doctor is saying, yeah, you have your gallbladder. Yeah, it looks like it's infected, and you have cholecystitis. You're not like, yeah, okay, doc. You know what's going on because you checked it out here on Your Caring Docs, right? So we have our gallbladder episode that we did a few weeks ago. Boom, it's up there. It's on the YouTube channel. It's on our Instagram. It's here on the Facebook channel. I mean, it's out there, so you know what's going on. So let's go over all that we have learned so far, right? So we learned about urinary tract infections versus pyelonephritis. Pyelo what? That's right. Pyelonephritis, when that urinary tract infection goes out of whack and goes up into the kidneys and causes inflammation, irritation of the kidneys, that lower back pain, pain when you urinate, fevers, and so on. Pyelonephritis. So you learned about that. You learned about pink eye. Another word for that, conjunctivitis, right? Because you guys are superstars, so you using your medical terms. You learned about sinusitis. Boom. You know what's going on in your sinuses when it becomes inflamed. You learned about sore throat. Another word for that, pharyngitis. Yes, the strep versus the viral sore throat, and why one needs an antibiotic and why one doesn't. Right? We know that. We learned about muscle strains versus muscle sprains. Learned how to do some exercises in order to strengthen those knee pain. If we have any sprains and strains in our knees, we learned about ear infections. We learned about stroke. Yes, the different types of strokes. We learned about heart attacks, what causes a heart attack, what are some of the treatment plan that occurs, and why is it that, of course, when you go to the ER and they do that EKG and then they're rushing you off, and it's like, listen, we got to take you to cath lab, we got to do this, got to do that. You know what's going on, right? You also learned about reflux disease. And we're probably going to be using some of that info because it's Christmas. So we know that we're eating. And tonight, some of us might be having reflux disease. So use that info that you learned in that video before so that we can settle that stomach and feel great in the morning, right? And of course, we learned about the flu and why it's so challenging to make that flu vaccine. And we learned about COVID. Yes. So we learned about some of the ways that we should be protecting ourselves. And we also learned that if you do get this COVID virus and it's a mild virus, that we need to have a pulse ox machine, a pulse oximeter, our fever reducing medications such as our acetaminophen, which is another term. Tylenol is a brand name of an acetaminophen. Our ibuprofens, which Motrin is a type. That's another brand name for the ibuprofen. We also learned that we need to stock up on some vitamins. For example, vitamin C, zinc, vitamin D. Now we need to ensure that we're taking our vitamin D so we can build up our defenses against all that's going on, all these viruses, that now that it's the winter time, it's more than just the COVID virus. We still have some of our old common viruses like the rhinovirus when it causes a cold. Of course, we talked about flu. And so the coronavirus isn't the only virus that's out. We have, some of the other viruses. Corona is the one that's really, ramping up right now. But some of those older viruses that would have given you aches and all the issues during the wintertime, it's still out there. So let's bring up that defense. So zinc, our vitamin C, our vitamin D, our selenium. Let's hit those multivitamins and get ourselves, boom, on that defense, right? So now, before I do go, I do want to let you guys know today is post-COVID vaccination day 8, right? So it's actually 8.5 because I got my vaccine like boom at the butt crack of dawn. I was not waiting. 7:25 a.m. that Thursday morning. So it'll be 8.5 days since I've had the vaccine. And I'm telling you, I am feeling great, right? I'm not having any symptoms at all. At all. So when that vaccine comes out, we got to take it so we can get out of this pandemic, because I don't know about you, but next Christmas, I want all my family together, right? I would love to be able to spend that Christmas with my parents, have them see their grandkids and not have to worry. So I am going to check out because I know some of you stopped by to watch me and I do appreciate it, but I know you want your Christmas dinner. So I will see you, guess what? Next year, yes, the year is over. I will see you next year where we're going to go over some great medical topics so that you can be well informed about what's going on in your body. And when you're discussing things with your doctor, you can come up with a great plan and you'll probably stick to it because you understand why, right? So I'm Dr. Tamara Beckford with Your Caring Docs. I wish you a very Merry, Merry, Merry Christmas and all the best for the new year. I will see you next year, which is basically next week, right here. Bye-bye.